Bismillahirrahmanirrahim. Quote of the day. It is also charity to utter a good word by Prophet Muhammad, peace be upon him. I'm Dr. Muneeb Altaf, and today my topic of presentation is Baby Friendly Hospital Initiative, Breastfeeding and Kangaroo Mother Care. Learning outcome are the steps of Baby Friendly Hospital Initiative, Kangaroo Mother Care, exclusive breastfeeding technique, and breastfeeding advantages. Breast Baby Friendly Hospital Initiative, a joint program of UNICEF and World Health Organization. The Baby Friendly Hospital Initiative has identified 10 steps to promote, protect, and establish breastfeeding in the maternity and pediatric hospitals worldwide. To achieve the BFHI accreditation, health facilities must demonstrate a rate of at least 75% exclusive breastfeeding among mothers at discharge, adherence to the International Code of Marketing Breast Milk Substitute, and successful implementation of 10 steps to successful breastfeeding. 10 steps to successful breastfeeding and the code. Have a written breastfeeding policy that is routinely communicated to all healthcare staff, comply fully with the International Code of Marketing of Breast Milk Substitute and relevant World Health Assembly resolution, train all the healthcare staff in skills necessary to implement this policy, inform all pregnant women about the benefits and management of breastfeeding. Have mothers to initiate breastfeeding within half an hour of the birth, show mother how to breastfeed and how to maintain lactation even if they are too separated from their infants, give newborn infant no food or drink other than breast milk unless medically indicated, and practice rooming in, allow the mother and infant to remain together 24 hours a day. Encourage breastfeeding on demand. Give no artificial dates or pacifier, also called dummies or soother, to breastfeeding infant. Foster the establishment of breastfeeding support group and refer mothers to discharge on discharge from the hospital or clinic. So this is what the hospital can do. Uh, Not promoting infant formula. Number one, hospital policy should be there. And number two, the staff competency. The staff should be competent enough to train on the sport for the supporting the mothers for breastfeeding and assessing the workers' knowledge and skills. Third is the antenatal care, the and discussing the importance of breastfeeding for babies and mother, and preparing the woman in how to feed their baby. Fourth is a care right after the birth. After the birth, encouraging the skin to skin contact between mother and baby soon after the birth. Fifth is a supporting a mother with breastfeeding, checking the position and attachment and sucking, giving practical breastfeeding support. Sixth is a supplement. Supplement should be given if there is any medical reason or contraindication for the baby of breastfeeding. And seventh is a rooming in, letting the mother and baby stay together day and night. Eighth is the responsive feeding, helping the mother know when baby is hungry and not limiting the breastfeeding times. Ninth is the bottle dates and pacifier use. Counsel the mother on the use and risks of feeding bottle dates and pacifier. Tenth is the discharge. On the discharge, referring the mother to the community resources for breastfeeding support and working with communities to improve breastfeeding support services. Since BFHI began, more than 152 countries around the world has implemented the initiative. BFHI promote a multi-level, multi-sector approach which together with the legislation regarding the maternity leave and protection of the breastfeeding rights of women in the workplace, enforcement of code marketing of breast milk substitute is essential to effectively promote and support breastfeeding. And monitoring and reassessment of BFHI facilities are important as the initiative expands. Benefits of BFHI. BFHI has shown to be very effective in increasing breastfeeding initiation, exclusive breastfeeding, breastfeeding duration in many countries, improving mothers' health care experiences, and reducing the rate of infant abandonment. Re-evaluation of BFHI. In 2015, WHO and UNICEF began a process to reevaluate and reinvigorate the program of BFHI, a WHO guideline protecting, promoting, and supporting breastfeeding in facilities providing maternity and newborn services was published in 2017 based on a careful examination of evidence for each of the 10 steps and updated implementation guidance for countries implementing the BFHI was published in 2018. The countries are called upon to form a key responsibility through a national BFHI program, establish or strengthen the national breastfeeding coordination body, integrate the 10 steps into the relevant national policy document, ensure the competency of health professionals and managers in the implementation of 10 steps, utilize external assessment system to regularly evaluate adherence to the 10 step, develop and implement incentive for the compliance and sanctions for non-compliance with the 10 steps, provide technical assistance to the facilities that are making changes to adapt the 10 steps, and monitor implementation of the initiative, advocate for BFHI to relevant audiences, and identify and allocate sufficient resources to ensure the ongoing funding of initiative. So this is the article showing the implementation of baby-friendly hospital initiative in various private and public hospitals of Lahore. The aim is to determine the implementation of 10 steps of BFHI in the randomly selected private and public hospitals of Lahore. And the results show that 60.8% of BFHI guidelines are being observed and implemented. The conclusion, the maternity care practices in hospital, the clinics of Lahore are not completely being carried out according to 10 steps for successful breastfeeding for maternal and child being. Lack of resources, inadequate training of the health staff, and high patient load are key hurdle in the implementation of these steps. In Pakistan, breastfeeding rates are still low according to the National Survey, Nutrition Survey in 2018. The proportion of proportion of children put to breast within 1 hour after the delivery was 48.8% and exclusive breastfeeding was 48.4%. Now come to the breastfeeding. Breastfeeding is the feeding of an infant or young child with the breast milk directly from the female breast. It is a normal way of providing young infants with the nutrition they need for healthy growth and development. Reflexes in the baby. The baby's reflexes are important for appropriate breastfeeding. First of all, the rooting reflex. When something touches the baby's lip or cheek, the baby turns to find the stimulus and open his or her mouth, putting his or her tongue down and forward, present from about 32nd week of pregnancy. Second is the sucking reflex. When something touches a baby's palate, he or she starts to suck. Third is the swallowing reflex. When the baby's mouth fills with milk, he or she swallows. Preterm infant can grasp the nipple from about 28 week of gestation. They can suckle and remove some milk from about the 31st week. Coordination of suckling, swallowing, and breathing appears between 32 and 35th week of pregnancy, and a majority of infants can breastfeed fully with gestational age of 36 weeks. Types of milks are the colostrum, transitional milk, mature milk, preterm milk, fore milk, and hind milk. Colostrum, it appears in 2 to 3 days after the delivery. In small amounts, about 40 to 50 ml on the first day, but that is all an infant normally needs at that time. Rich in white blood cell antibodies, especially IgA, and it contain a larger percentage of protein, minerals, and fat, soluble vitamins A, E, and K, and then later. And yellowish in color and provide important immune protection. And the epidermal growth factor helps to prepare the lining of the gut of the baby to receive the nutrients in the milk. Transitional milk appears after 7 to 8 days. Infant receive colostrum and not other feed at that time. It acts as a laxative and helps to pass the meconium and prevent jaundice. Milk starts to be produced in larger amount between 2 to 4 days after delivery, making the breast feel full. The milk is then said to have come on. On the third day, an infant is normally taking about 300 to 400 ml per 24 hour. On the fifth day, it goes to 500 and 800 ml. Mature milk follows the transitional milk, more thinner and watery, contain the essential nutrients for growth of the baby. And preterm milk is the milk which is produced by the mother who gave birth prematurely, and it has high quantity protein, sodium, iron, and immunoglobulins. Fore milk is the secreted at the start of the feed, a watery, rich in protein, sugar, vitamin, and mineral, and it satisfies the baby's thirst. And hind milk come later towards the end of the feed, richer in fat content, provides more energy and satisfies the baby's hunger. For optimal growth, both fore and hind milk are needed. Be allowed to empty one breast fully first, and baby who receives only fore milk cry excessively. Storage of the milk, human milk can be stored at room temperature for 6 to 8 hours. Expressed milk can be stored in an insulated cooler bag with ice pack for 24 hours. Breast milk can be stored in the refrigerator for about 5 days at the 40 Fahrenheit temperature. It can also be kept in a freezer compartment of a fridge for up to 2 weeks at 0 to 5 Fahrenheit temperature, and it can be stored in the freezer for about 3 to 12 months. Preparation for successful breastfeeding. Firstly, there should be the motivation for the mother before birth. Select rice flour for delivery. Avoid unnecessary use of drugs prior to delivery. Initiate breastfeeding soon after delivery. Give colostrum and avoid pre-elective feed. Help the baby suckle in a good position. Recommended demand feeding, and continue each feed as long as baby wants. Do not wash nipple before and after the feed. Caution the mother in advance for the engorgement. Breastfeeding techniques. Firstly, there should be the good attachment of the baby and the mother. Much of the areola and tissue underneath it, including the larger ducts, are in the baby's mouth. The breast is stretched out to form a long teeth, but the nipple only form about one third of the teeth. The baby's tongue is forward over the lower gum beneath the milk duct. Baby is sucking from the breast, not from the nipple. And the poor attachment, only the nipple is in the baby's mouth, not the underlying breast tissue or duct. Baby's tongue is back inside his or her mouth and cannot reach the duct to press them. Suckling with the poor attachment may be uncomfortable or painful for mother and may damage the skin of the nipple and areola, and may result in inefficient removal of the milk and apparent low supply of the milk. Effective suckling is when the baby is well attached. The baby takes slow, deep suckle followed by visible or audible swallow about once per second. Sometimes the baby pauses for a few seconds, allowing the ducts to fill up and milk again. When the baby starts suckling again, he or she may suckle quickly a few times, stimulating the milk flow, and then slow, deep suckle begin. The baby's cheek may drawn in during the feed. Towards the end of the feed, suckling usually slow down and fewer deep suckles and no longer and longer pauses between them. This is the time when the volume of milk is less, but it is fat rich hind milk. It is important for feed to continue. When baby is satisfied, he or she usually releases the breast spontaneously. The nipple may look stretched out for a second or two, but it quickly returns to its resting position. Signs of ineffective suckling. Poorly attached suckle quickly at the time without swallowing. Cheeks may be drawn in as he or she suckle, showing that milk is not flowing well into the baby's mouth. When baby stops feeding, the nipple may stay stretched out and look squashed from side to side with a pressure line. across the tip, showing that the nipple is being damaged by incorrect section. Consequences of ineffective suckling. When a baby suckle ineffectively, transfer of milk from mother to baby is inefficient. As a result, poor weight gain of the baby, blocked duct or mastitis. Baby may pull away from the breast out of frustration and refuses to feed. Baby may be very hungry and continue suckling for a long time or feed very often. The breast may be overstimulated by too much suckling, resulting in oversupply of milk. Causes of the poor attachment, use of a feeding bottle, function difficulties such as flat and inverted nipple, a very small or weak infant, inexperience of the mother. Breastfeeding position. The baby's body should be straight, not bent or twisted. The baby's head can be slightly extended at neck, and he or she should be facing the breast. The nipple usually points slightly downward. Breastfeeding position, cradle hold. This is the most common position used by the mothers. Infant head is supported in the elbow, the back and buttock is supported by the arm and lifted to breast. Second is the football position, hold position. The infant's is placed under the arm like holding a football, and baby's body is supported with the forearm and head is supported with the hand. Many mothers are not comfortable with this position. Good position after the operative procedures. Side lying position. The mother lies on her side, dropping up her head and shoulder with pillow. The infant is also lying down facing the mother. Good position after the C-section. Allow the new mother some rest, and most mothers are scared of touching the baby. Cross cater hold position, ideal for early breastfeeding. Mother holds the baby crosswise in the crook of the arm opposite the breast. The infant is to be fed, and baby's trunk and head are supported with the forearm and palm. The other hand is placed beneath the breast in a U-shaped manner to guide the baby's mouth to the breast. Now, the advantages of breastfeeding to child: complete nutrition. It contains most suitable protein and fat rich in essential fatty acids, more lactose other than the other milk, enough vitamins and iron and calcium and phosphate. Some enzyme like lipase helps in proper digestion of the fat. Uh, now, again, the advantage to the baby is the cover against the infection. Has anti milk has anti infective factors like immunoglobulin, lactoferrin, lysozyme cells like T and B lymphocytes, and antiviral factor. Now, advantage of breastfeeding to the mother: convenient, cheaper than artificial milk, helps in the expulsion of placenta, and calming effect, contour of the body come back to the normal. Advantages of the breastfeeding to both mother and child: develop a close loving bond, child spacing, and cost benefit. Barriers to the breastfeeding: lack of confidence in mother, believe that the breast milk is not sufficient, lack of adequate support system, history of previous breast surgery, breast engorgement, crackled and sore nipple, and embarrassment by the mother, and chronic illness like psychosis and cancer. Contraindication to the breastfeeding: HIV infection, active tuberculosis, herpes lesion on the mother's breast, infant with the inborn error of metabolism like phenylketonuria and should not be breastfed, mother or certain medications like anti-cancer therapy or radioactive isotope. Feeding is withhold for the period of the mother is on the drug. Issues in breastfeeding: inverted slash flat nipple, sore nipple, breast engorgement, breast abscess, and not enough milk. Rules of breastfeeding: exclusive breastfeeding for about 6 months and to continue for at least the second year. Complementary food rich in iron and other micronutrients should be started at 6 months of age. Mother and infant should sleep in proximity to each other to facilitate breastfeeding. Initiation of breastfeeding should be encouraged as soon as possible after the birth, ideally within 1 hour. Ensure 8 to 12 feedings every 12 hours till 2 to 3 months, and then 6 feeding till 6 months, and 5 feeding till a year. At every feeding, the infant is placed only on one breast, and during the next feeding, it should be on the other. The duration of feeding is about 20 to 30 seconds, but it can vary according to the frequency of and the duration of feeding with a day. The amount of milk that breast produce depend upon partly on how much the baby suckle, how much milk he removes. More suckling makes more milk. Breastfeed flow does not depends partly on the mother's thoughts, feeling, and sensation. It is important to keep the mother and babies together day and night, and to help the mothers to feel good about breastfeeding. Give no supplementation. Pacifier should be offered while placing infant in a back to sleep position or no earlier than 3 to 4 weeks of age. All the breastfeeding newborn infants should be seen by pediatrician at 3 to 5 days of age, who should evaluate hydration, body weight, and assess the feeding and consider more frequent follow-up and discuss the maternal and infant issues. Kangaroo mother care. Kangaroo mother care is when the your baby is placed on the chest. This allows for skin to skin contact between you and baby. During each session, your baby will be placed naked except for the diaper or hat on your chest for up to a few hours. A blanket, shirt, hospital gown, or robe can be wrapped around you and over your baby's bag for warming. This wrapping of your infant into your chest looks very much like the mother kangaroo holding her baby in her pouch, which is where the name kangaroo comes from. Kangaroo mother care is recommended for the routine care of newborn weighing less than 2 kg at birth and should be initiated in the hospital care facilities as soon as the newborn are clinically stable. Newborn weighing 2 kg or less than that at birth should be provided as close to continuous kangaroo mother care as possible. Intermittent kangaroo mother care rather than conventional care is recommended if the kangaroo mother care is not possible. Conventional neonatal care of low birth weight infant is expensive and need both highly skilled personnel and permanent logistic support. Evidence suggests that kangaroo mother care is a safe and effective alternative to conventional neonatal care, especially in under-resourced setting, and may reduce morbidity and mortality in low birth weight infants as well as increasing breastfeeding. Kangaroo mother care involves early, continuous, and prolonged skin to skin contact between a mother and her newborn, frequent and exclusive breastfeeding, early discharge from the hospital. Benefits of kangaroo mother care to the baby: stabilizes your baby's heart rate, improving your baby's breathing pattern and making the breathing more regular, improving oxygen saturation, gaining in sleep time, experiencing more rapid weight gain, decreasing crying, having more successful breastfeeding episode, having an earlier hospital discharge. Benefits of kangaroo mother care for parents are improving bonding with your baby and feeling of closeness, increasing your breast milk supply, increasing the confidence in the ability to take care of your new baby, increasing your confidence that baby is well cared for, increase the sense of control. This is an article showing the effectiveness of the self of the education program to improve self efficacy and exclusive breastfeeding rate, single blind RCT. Uh, the objective is to develop an integrated breastfeeding education program based on self efficacy theory and evaluate the effect of intervention on the first time mother's breastfeeding self efficacy and attitude. The conclusion shows that the breastfeeding education intervention and improved breastfeeding self-efficacy, infant feeding attitudes, and exclusive breastfeeding rates. The breastfeeding education program could be effective for sustaining breastfeeding in new mothers. Now it's time for MCQs. When the baby is placed skin to skin on the mother at birth, what behavior should he demonstrate instinctively before latching? Moving to the breast and touching the mother's body and breast, slowly going into the deep sleep, then starting to move hands and feet, crying vigorously, and then resting without movement, slowly calming down so the helper can assist the baby to reach the breast and moving to the breast, but sleeps without feeding. Anyone? The answer is A. Moving to the breast and touching the mother's body and breast. Number two, why is suckling at the breast important at the first 2 hours when the baby is ready? Mother can safely rest after the first suckling, prevent the infant dehydration. Infant is fed so glycemic level remains normal. Suckling triggers the normal onset of milk production. So, and number E is so that the baby can easily get the transitional milk.
D.
Delta. D.
Delta.
D is the right option. Number three, which statement about the exclusive breastfeeding is correct? Baby will get all the nutrients needed by effective breastfeeding. Mother do not have enough breast milk in the first few days. Some supplementation and artificial milk will not alter the intestinal microflora. Mothers need to exclusively breastfeed every 3 to 4 hours to have enough milk, and breast milk does not partly depend on mother's thought and emotion.
Alpha.
Alpha.
Yes, alpha
A.
is the answer. Question number four. What information would you share with a mother about a normal baby typical feeding pattern in the first 36 hours of life? Feeding pattern are determined by mother so that the infant is correctively trained to the feeding schedule. B is minimizing the minimum feeding frequency is 8 to 10 times per 24 hours. Mother should only feed the baby 6 times per 24 hours. Cluster feeding indicate low milk transfer and baby necessitate the supplementation, and she should initially be bottle fed.
Alpha.
B.
Yeah,
B.
beta is the answer. Minimum feeding frequency should be 8 to 10 times per 24 hours. Question number five, which nutritional supplement is deficient in breast milk and should be given to exclusive breastfeed child?
Vitamin A.
Yeah, it's the answer is D, vitamin D. What are the two things that should be observed when assessing a full breastfeeding session? Infant has sucking movement at the jaw. Infant sucks at both breasts. Infant has rhythmic breast burst of sucking with the brief pauses. Infant releases the breast at the end of feed in obvious satiation. Number C is mother supports the infant's head. Mother admit her nipple hurt a little during the feed. D is mother's nipple hurt a little at the beginning. E is infant should move his or her hand and feed vigorously. Yes, B is the answer. Infants have rhythmic burst of sucking and brief pauses. Question number seven, what is the best way to help a mother achieve a comfortable and safe position for breastfeeding during the hospital stay? Encourage a mother to try a number of different positions very early so she can choose the one she prefers. B is help the mother identify how to hold her baby to best facilitate the baby's innate reflexes and latching. C is show the mother by placing her baby at the breast of her. D is use picture and doll so
E.
that the standard on one position is always given. E is show her a video about football hold position.
Delta.
C.
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 Its answer is B. Helps the mother identify how to hold her baby to best facilitate the baby's innate reflexes and latching. Question number 8. When helping a mother to achieve an effective and comfortable latch, what is the first thing to do? Number A is observe the mother breastfeeding. Number 2 is ensure the mother bring the baby to the breast, not the breast to the baby. Explain the pain is normal for the first few weeks. Demonstrate to the mother how to release a latch that is painful or shallow without hurting herself. Use the lubricant on breast for painless feeding.
C.
Yes, the first steps will be the observation of the mother breastfeeding. Question number 9. How can healthcare provider helps or influence facilities to avoid deliberate or accidental promotion of feeding bottles or teats? Prohibit any poster or material with the images of bottle and teats. Allow the products that fall under the code be visible to the parents. Display images and poster featuring bottle feeding infants. Allow marketing of bottles and teats to the public, putting the bottle in the hospital room for feeding.
Alpha.
Yes, alpha is the answer. Prohibit any poster or material with the images of bottle and teats. Question number 10. To tell the importance of breastfeeding to a pregnant woman, what are the most appropriate words to use? Lactation of many months reduces your risk of breast cancer. Postpartum fertility is delayed. And with exclusive breastfeeding, infants more readily progress through the instinctive stages. Number D is breastfeeding is healthy for you and your baby. Number E is breastfeeding is harmful for you.
Delta.
Yes, delta is the answer. Breastfeeding is healthy for you and your baby. This is the key, and thank you.
Thank you so much, Dr. Muneeb. We can end the meeting.